do have that 1-inch border. Just try folding these areas like that.
Okay.
Got it?
Yeah.
Yep.
Oh my gosh. That is just not working. And then we do dominant first. Yes. Dominant first.
Dominant first.
Yeah.
Yep. Dominant hand first. Yep.
I'm scared to do it.
Listen, we have lots you can practice with, so don't be afraid. And you know what? Sometimes it might just, like, you may need, these are 5.5, so they're very small sterile gloves.
Yeah, they are.
So, it may just be the size.
Go under.
And
I don't know, but
she has the big ones.
Well, I mean, it's really nice because. Oh, geez, these are giant.
They
I
are.
can't get them on my finger.
But that was very good.
Okay.
That was very good.
Go on my forehand. You don't go on my fingers.
You might just need a bigger size.
I got it.
There you go.
You can use my giant one.
Now just be careful. Yep. You want to do that on the cuff, yeah? That's okay. It's just,
I can't get in there. But
it's honestly probably just the size. You probably would be fine.
okay, and then you bend this down.
What are you touching there?
Oh man.
Do you want to try with bigger size?
Yes, because I don't feel like I'm doing it right. But I can't get them the whole way down on my fingers because they're tight.
Yeah.
And then we just take these off.
The same way that we did the donning and doffing last week, so you'll take those off the same way.
So what station are you at?
At the wound measurement.
The wound measurement. So how do you think you measure wounds?
You have to measure the biggest part.
Okay.
So if it's the length, you would measure it from the widest.
Okay.
So like that. And then up and down, you have to measure it from, again, the biggest part.
Good.
And then you have to measure the width, and you would put this kind of inside,
Okay.
and then measure it like that.
Another little trick to do is when you measure it, put the Q-tip back down there. Take your finger. Obviously you'll have gloves on.
Yeah.
Use your finger, and you can use your finger as a measuring guide wherever it's in
So like
the skin.
Okay.
And then you can take whatever remaining is left up to your ruler so you get a broken out
Okay.
measurement.
Thank you.
You always go to the longest too. So if it's, whatever area is the longest.
So from the overall wound too, so you would include this?
Well, not in the overall length. You would just say undermining at 4 centimeters, 3
I
centimeters.
guess.
Yeah.
What am I gonna put in here?
So the depth of the overall wound is different than the
Straight skin.
Like so, but in that one, like the tunneling, that was the deepest part, so that would be your depth.
okay.
But your underlying, it's a wound all
Some type of wet
because you have to deal with this.
You can have different wet solutions that the doctor orders to pack it in. So sometimes you'll see normal saline. Sometimes you'll see acetic acid. What do you think that is before? Affected, and then it's an acid, so it's going to do what to the yeah, it's gonna start to break down the tissue that's there, hopefully.
Be like before procedure, like iodine. Why would we put betadine gauze in a wound? What would it do? Help heal it, or prevent any kind of infection? Yeah, further infection. Yep. And then the last one that they often order is called Dakin solution, and it's like a bleach solution. So same thing, helps with infection, okay, and debridement. So this one, what do you have ordered?
Clean coccyx wound with normal saline. Perform wet to dry dressing change with acetic acid and fluff gauze.
Okay. So we would want the acetic acid, right? And then which one of these is our fluff gauze?
This?
Yep. Well,
Oh, there's one out.
so that is fluff gauze. This is actually, I just brought this to show you. This is called a Curlex roll. when you're doing wet to dry dressings, especially if the wound is bigger and tunneling like this one is, you want to use ideally just one piece of packing. And the reason for that is whenever the next person comes to do the dressing change, then they're just pulling one piece of packing out, not 6 or 7, and one, you know, because one could potentially get lodged or missed inside that dressing, and then that could breed infection, right? So this one says fluff gauze, which we'll show you how to use, but ideally you could use like a bigger Curl-X roll to pack that with, okay? So this is the fluff gauze, okay? First you would cleanse it. So how do we think we want to do that?
With normal saline.
Mm-hmm. So walk me through it. What do I do?
You wet the bandage and then.
Yeah, you could wet the bandage. Would we want the patient laying on their back or?
On their side.
Yeah.
To let it.
Yep, lay them on their side, right, so that you can visualize the wound. And then the easiest way to do it, you could wet a fluff gauze and moisten it and clean it off. But you could also take a sterile syringe and kind of like the irrigation station, just irrigate the wound with saline. You just want to put a green pad down first so that you don't get your bed all wet, okay? All right, so we did that. Now we're going to pack it with the acetic acid and the fluff gauze. So the easiest way to do this is whoever wants to open this up a little bit, not the whole way. Right like that. So you don't want to touch the gauze that's inside because we want to keep this as clean as possible, right? And typically before we actually go to pack this into the wound, we should be donning sterile gloves, especially if it's a wound that is pretty infected looking. So you're going to take this and hold it over the garbage, and you're going to take your whatever solution is ordered, in this case it's acetic acid, and you're going to pour some directly on top. And then you're going to, from the bottom of it, squeeze out the extra, kind of tilt it over. Yep.
Do you want it like fully saturated or like moist, or like how wet do you want it to be?
So great question. No, you don't want it saturated, you just want it moist. So when you're done soaking it, then you can open it the rest of the way up. And you would don either clean or sterile gloves depending on, like I said, how it was ordered in the hospital policy. And then when you're ready to actually pack it in the wound, you don't have to put gloves on because it's just water, but go ahead and pick up your solution. So that's a little bit, see how it's dripping?
Yeah.
So you want to squeeze out the extra still. Yep. And then you would take so you want to separate that though. Yep, and then leave one piece there, and then continue to separate that because we want to get in all these nooks and crannies. And then we have these little sterile Q-tips that are helpful whenever you're actually packing it into the wound bed itself. So, yep, you would want to start with, you don't want to lay it over top.
Okay.
You want to, yep. Are you right-handed?
Yes.
Okay, so take your Q-tip in your right hand. There you go. And, yep, pack it in, yep, just like that. So, but this is pretty deep, so you want to pack, yep, keep packing until you can't pack anymore. The whole way back. So that looks okay, but one of the biggest things about wet to dry dressings, especially for something that's tunneling, oops, I just broke that stick, is that you want it to be really tight and compact. So I would keep one piece of it over here all together, okay? And then when you're ready, take your other piece and go ahead and pack that one in here. Get you another Q-tip here in a second. That should be okay.
Sorry.
You're okay. Alright. And then use your little tiny Q-tip and, yep, pack it into there. can kind of already see the importance of using, if you can use one piece, because see how tight that gets packed in there. If this is a wound that's straining a lot, someone could easily overlook that and leave it in the wound bed. But when this is all done, this would take like 6 or 7 pieces probably of the flip gauze, but you would want this to be nice and compact, just like this one is. Okay? So then, now what do? Do we just leave it like that?
Cover it.
With what?
ABD and paper tape.
Okay, so what is the ABD pad? What is that?
So is that both of these boxes?
Yeah, either one. So take one out, and then you want to open it up. The whole way? Yeah, you can use it. And then you're going to, place it over your finished dressing, which again, that would be nice and packed. Okay.
Does the line go down? Or?
It doesn't matter. And then which way, or what then would you want to do with that?
Tape.
Okay, what kind of tape do you want to use?
Paper tape?
Paper tape. Why?
Allergies to medical tape.
Possibly, but what else? What?
Doctor's order.
No.
Is it not as like sticky? Like it won't hurt as much?
Yeah. So
taking
you're
off?
putting it on good skin, right? So you don't want to give that patient a skin tear or cause more irritation to the skin. So paper tape tends to be less irritant, and it's not going to maybe stick as well as some of the other types of tapes that we have in the hospital, but it's what you should use to secure your dressing, especially if the patient has sensitive skin.
And then how many times would you be changing that? Like,
So it depends on the doctor's order. Typically they're ordered BID, which means what? Twice a day. So you would do it around what times? Morning and night. So like 9 a.m. and 9 p.m. But it depends, again, on
Because this white here, that's going to represent like that slothy, and that's not the stuff you want to culture. So absolutely, you're going to go up in this healthy part right there.
And would you break this right after your first one then, so you can just put it in?
I would
or-
break it right away so that it can
Okay.
go, like when you are preparing it, it can go right in there and then you're not messing with anything.
Okay.
Yep.
I'll get you guys.
Thank you.
Sponge in the way. Does that sponge stay in there?
What's that?
Does that sponge stay in there?
Yeah, the sponge stainer. Usually it will have some kind of solution in there to help
Okay.
preserve or keep, or usually it's just some kind of like nutrients if there's bacteria in there, so that they can kind of like use it so they can survive essentially.
Okay.